The nurse would question the use of mannitol, osmotrol, for which patient condition? A. Increased intraocular pressure. B. Inuria related to end-stage kidney disease. C. Cerebral edema from head trauma. D. Oliguria from acute renal failure. Answer. B. Inuria related to end-stage kidney disease. Rationale. Mannitol does not influence urine production. It only increases existing urine output. It is not metabolized but excreted unchanged in the urine by the kidneys. Thus, if no urine is produced, inuria, mannitol is not excreted, which increases blood volume. Excess blood volume may cause the undesirable adverse effect of pulmonary edema. Why does the healthcare provider prescribe furosemide, Lasix 40 mg twice a day by mouth for a patient with a history of renal insufficiency? A. Furosemide has an antagonist effect to prevent respiratory alkalosis. B. Furosemide is effective in treating patients with hypoaldosteronism. C. Furosemide is effective in treating patients with impaired kidney function. D. Furosemide helps the kidney with reabsorption of sodium and water. Answer. C. Furosemide is effective in treating patients with impaired kidney function. Rationale. Furosemide effectiveness continues in impaired renal function. When creatinine clearance decreases below 25 L per minute, normal is 125 L per minute, the loop diuretics can still work. A patient asks the nurse about using potassium supplements while taking spironolactone, aldactone. What is the nurse's best response? A. I would recommend that you take 2 multivitamins every day. B. This diuretic is potassium sparing, so there is no need for extra potassium. C. I will call your healthcare provider and discuss your concern. D. You will need to take potassium supplements for the medication to be effective. Answer. B. This diuretic is potassium sparing, so there is no need for extra potassium. Rationale. Spironolactone is a potassium-sparing diuretic, and thus the patient does not need potassium supplementation. Intake of excess potassium may lead to hyperkalemia. When preparing to administer intravenous furosemide, Lasix, to a patient with renal dysfunction, the nurse will administer the medication no faster than which rate? A. 6 mg per minute. B. 4 mg per minute. C. 2 mg per minute. D. 8 mg per minute. Answer. B. 4 mg per minute. Rationale. Furosemide-controlled infusion rate should not exceed at a rate of 4 mg per minute in patients with renal failure. The nurse is reviewing the medications that have been ordered for a patient for whom a loop diuretic has just been prescribed. The loop diuretic may have a possible interaction with which of the following? A. Vitamin D. B. Warfarin. C. Penicillin. D. NSAIDs. Answer. D. NSAIDs. Rationale. Loop diuretics are used primarily for treating fluid accumulation, edema, and hypertension. These drugs are known to be contraindicated while administered with NSAIDs. Loop diuretics also have no known contraindications when administered along with warfarin, antibiotics such as penicillin, and vitamin D. Which is a true statement about carbonic anhydrase inhibitors, CAIs? A. CAIs induce metabolic alkalosis. B. CAIs can elevate the blood glucose level in patients taking oral hypoglycemics. C. CAIs are contraindicated in the presence of glaucoma. D. CAIs are effective as prolonged therapy for seizures. Answer. B. CAIs can elevate the blood glucose level in patients taking oral hypoglycemics. Rationale. An adverse effect of the CAIs is that they elevate the blood glucose level and cause glycosuria in patients with diabetes. The CAIs induce metabolic acidosis, are indicated for narrow-angle glaucoma, and their effectiveness for treatment of seizures decreases in a short time. A patient is being discharged home on a single daily dose of a diuretic, so that there will be no unnecessary disruptions to the patient's daily routine. The healthcare provider instructs the patient to take the dose at what time? A. In the morning. B. At noon. C. With supper. D. At bedtime. Answer. A. In the morning. Rationale. Diuretic medication should be taken early in the morning to prevent urination at nighttime. The manifestations of potassium deficiency include which condition? A. Dyspnea. B. Diarrhea. C. Weakness. D. Hypertension. Answer. C. Weakness. Rationale. Weakness is a manifestation of hypokalemia, low potassium levels. The nurse is teaching a patient about using hydrochlorothiazide. The nurse should ensure the patient knows to be cautious when taking which medication with hydrochlorothiazide? A. Digitalis. B. Antacids. C. Potassium supplements. D. Over-the-counter aspirin preparations. Answer. A. Digitalis. Rationale. There is an increased risk for digitalis toxicity in the presence of hypokalemia, which may develop with hydrochlorothiazide therapy. Potassium supplements are often prescribed with hydrochlorothiazide therapy to prevent hypokalemia. The other options do not have interactions with hydrochlorothiazide. The physician has ordered mannitol, osmotrol, for a patient. How should this drug be administered? A. Intravenously, through a filter. B. By rapid intravenous, IV, bolus. C. 20 to 80 milligrams orally, PO, daily, in a single morning dose. D. By oral or IV route, depending on the severity of the patient's condition. Answer. A. Intravenously, through a filter. Rationale. Mannitol should be administered via IV infusion, through a filter. It is not available in an oral form. Potassium-sparing diuretics may cause which common adverse reactions? Select all that apply. A. Dizziness. B. Hyperkalemia. C. Headache. D. Muscle weakness. E. Mental confusion. Answer. A. Dizziness. B. Hyperkalemia. C. Headache. Rationale. Hyperkalemia, dizziness, and headache are common adverse effects associated with potassium-sparing diuretics. For a patient prescribed hydrochlorothiazide, hydrodiuryl, the nurse should closely monitor which laboratory test value: A. Chloride, B. Calcium, C. Glucose, D. Sodium. Answer: C. Glucose. Rationale: thiazide and thiazide-like diuretics are associated with adverse metabolic effects of hyperglycemia. Therefore, close monitoring of blood glucose levels are needed. Other metabolic disturbances include hyperlipidemia and hyperuricemia. A patient is taking an aminoglycoside antibiotic for pneumonia and will also be taking the loop diuretic furosemide, Lasix, due to fluid overload. The nurse will monitor carefully for which potential effect from the interaction of these two drugs: A. Nephrotoxicity, B. Ototoxicity, C. Pulmonary fibrosis, D. Hepatotoxicity. Answer: B. Ototoxicity. An older adult patient has been discharged following treatment for a mild case of heart failure. He will be taking a loop diuretic. Which instruction, S, from the nurse are appropriate? Select all that apply. A. Take the diuretic at the same time each morning. B. Take the diuretic only if you notice swelling in your feet. C. Be sure to stand up slowly because the medicine may make you feel dizzy if you stand up quickly. D. Drink at least 8 glasses of water each day. E. Here is a list of foods that are high in potassium. You need to avoid these. F. Please call your doctor immediately if you notice muscle weakness or increased dizziness. Answer: A. Take the diuretic at the same time each morning. C. Be sure to stand up slowly because the medicine may make you feel dizzy if you stand up quickly. F. Please call your doctor immediately if you notice muscle weakness or increased dizziness. A patient with diabetes has a new prescription for a thiazide diuretic. Which statement will the nurse include when teaching the patient about the thiazide drug? A. There is nothing for you to be concerned about when you are taking the thiazide diuretic. B. Be sure to avoid foods that are high in potassium. C. You need to take the thiazide at night to avoid interactions with the diabetes medicine. D. Monitor your blood glucose level closely, because the thiazide diuretic may cause the levels to increase. Answer: D. Monitor your blood glucose level closely, because the thiazide diuretic may cause the levels to increase. When the nurse is checking the laboratory data for a patient taking spironolactone, aldactone, which result would be a potential concern? A. Serum sodium level of 140 MEq, lb. Serum calcium level of 10.2 mg, DLC. Serum potassium level of 5.8 MEq, LD. Serum magnesium level of 2.0 mg, DL. Answer: C. Serum potassium level of 5.8 MEq, L. Rationale: spironolactone, aldactone, is a drug used for treating fluid accumulation, edema, and in congestive heart failure condition. The normal potassium level in the serum is 3.5 to 5.0 MEq, L. Hence, the occurrence of 5.8 MEq/L after administering spironolactone, aldactone, is a matter of concern. A serum sodium level of 140 MEq/L, calcium level in the serum is 8.5 to 10.3 mg per deciliter, and magnesium level of 2.0 mg per deciliter are within the normal range. When monitoring laboratory test results for patients receiving loop and thiazide diuretics, the nurse knows to look for A. Decreased serum levels of potassium. B. Increased serum levels of calcium. C. Decreased serum levels of glucose. D. Increased serum levels of sodium. Answer: A. Decreased serum levels of potassium. Rationale: loop diuretics are used primarily for treating fluid accumulation, edema, and hypertension, especially in persons with normal kidney, renal functioning. These drugs tend to lower the serum potassium levels. However, these drugs do not increase the levels of calcium in the serum. Loop and thiazide diuretics do not result in decreasing the glucose levels in the serum. Elevated serum sodium levels are also not induced as an effect of administering loop and thiazide diuretics. Acetazolamide, Diamox, is used to treat which conditions? Select all that apply. A. Open-angle glaucoma. B. High-altitude sickness. C. Dry eye syndrome. D. Cardiac dysrhythmias. E. Edema associated with heart failure. Answer: A. Open-angle glaucoma. B. High-altitude sickness. E. Edema associated with heart failure. Rationale: acetazolamide causes excretion of bicarbonate, which would worsen metabolic acidosis. It is used to treat high-altitude sickness, edema secondary to heart failure, open-angle glaucoma, and rarely as an anti-epileptic drug. It is not used for treatment of dry eye syndrome or cardiac dysrhythmias. Which laboratory test result as a common adverse effect of furosemide, Lasix? A. Hypophosphatemia. B. Hyperchloremia. C. Hypokalemia. D. Hypernatremia. Answer: C. Hypokalemia. Rationale: furosemide is a potent loop diuretic, and the most common adverse effect of loop diuretics is electrolyte imbalances. This results in major electrolyte losses of potassium and sodium and, to a lesser extent, calcium. The nurse is providing education to a patient prescribed spironolactone, aldactone, and furosemide, Lasix. What information does the nurse explain to the patient? A. This combination promotes diuresis but decreases the risk of low levels of potassium. B. This combination maintains water balance to protect against dehydration and electrolyte imbalance. C. The lowest dose of two different types of diuretics are more effective than a large dose of one type. D. Using two drugs increases blood osmolality and the glomerular filtration rate. Answer: A. This combination promotes diuresis but decreases the risk of low levels of potassium. Rationale: spironolactone is a potassium-sparing diuretic. Furosemide is a potassium-losing diuretic. Giving these together minimizes potassium loss. A patient prescribed spironolactone, aldactone, Asks the nurse to assist with food choices that are low in potassium. The nurse would recommend which food choices? Select all that apply. A. Lean meat. B. Winter squash. C. Apples. D. Bananas. E. Pineapple. Answer. A. Lean meat. C. Apples. E. Pineapple. Rationale. Spironolactone is a potassium-sparing diuretic that could potentially cause hyperkalemia. Bananas in winter, not summer. Squash are high in potassium and should be avoided in patients taking spironolactone. When teaching a patient about symptoms of hypokalemia, the nurse will instruct the patient to notify the healthcare provider if which symptom occurs. A. Diaphoresis. B. Constipation. C. Blurred vision. D. Muscle weakness. Answer. D. Muscle weakness. Rationale. Muscle weakness is a common symptom of hypokalemia. The other answers are incorrect. When assessing a patient taking triamterene, direnium, the nurse would monitor for which possible adverse effect. A. Hyperkalemia. B. Hypoglycemia. C. Hypernatremia. D. Hypokalemia. Answer. A. Hyperkalemia. Rationale. Triamterene is a potassium-sparing diuretic, and therefore hyperkalemia is a possible adverse effect. A patient in the neurologic intensive care unit is being treated for cerebral edema. Which class of diuretic is used to reduce intracranial pressure? A. Loop diuretics. B. Osmotic diuretics. C. Thiazide diuretics. D. Vasodilators. Answer. B. Osmotic diuretics. Rationale. Mannitol, an osmotic diuretic, is commonly used to reduce intracranial pressure and cerebral edema resulting from head trauma. A patient with a new prescription for furosemide, Lasix, is being discharged. What should the nurse say to this patient concerning this new prescription? A. Keep a weekly journal or log of your weight. B. Avoid foods high in potassium, such as bananas, oranges, fresh vegetables, and dates. C. If you experience weight gain, such as 2.3 kilograms or more a week, be sure to tell your physician during your next routine visit. D. Be sure to change your body position slowly and rise slowly after sitting or lying. Making slow movements will prevent dizziness and possible fainting because of blood pressure changes. Answer. D. Be sure to change your body position slowly and rise slowly after sitting or lying. Making slow movements will prevent dizziness and possible fainting because of blood pressure changes. Rationale. Orthostatic hypotension is a possible problem with diuretic therapy. A daily log of weight should be kept. Foods high in potassium should be eaten more often, and a weight gain of 2.3 kilograms or more a week should be reported immediately. To evaluate the therapeutic effects of mannitol, osmotrol, the nurse should monitor the patient for which clinical finding? A. Decrease in intracranial pressure. B. Decrease in serum osmolality. C. Increase in urine osmolality. D. Increase in cerebral blood volume. Answer. A. Decrease in intracranial pressure. Rationale. Mannitol is an osmotic diuretic that pulls fluid from extravascular spaces into the bloodstream to be excreted in urine. This decreases intracranial pressure and cerebral blood volume, increases excretion of medications, decreases urine osmolality, and increases serum osmolality. To treat a patient with pulmonary edema, the nurse prepares to administer which diuretic to this patient? A. Amiloride, Midamor, B. Furosemide, Lasix, C. Spironolactone, Aldactone, D. Triamterene, Direnium. Answer: B. Furosemide, Lasix. Rationale: furosemide is a potent, rapid-acting diuretic that would be the drug of choice to treat pulmonary edema. The other medications are not potent enough to cause the diuresis necessary to treat this condition. To treat a patient diagnosed with primary hyperaldosteronism, the nurse would expect to administer which diuretic? A. Acetazolamide, Diamox, B. Furosemide, Lasix, C. Hydrochlorothiazide, Hydrodiaryl, D. Spironolactone, Aldactone. Answer: D. Spironolactone, Aldactone. Rationale: spironolactone is the direct antagonist for aldosterone. A patient is started on a diuretic for antihypertensive therapy. The nurse expects that a drug in which class is likely to be used initially? A. Loop diuretics, B. Osmotic diuretics, C. Thiazide diuretics, D. Potassium-sparing diuretics. Answer: C. Thiazide diuretics. Rationale: the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, JNC7, guidelines recommend thiazide diuretics as the first-line treatment for hypertension. The other drug classes are not considered first-line treatments. When a patient is receiving diuretic therapy, which of these assessment measures would best reflect the patient's fluid volume status? A. Blood pressure and pulse, B. Serum potassium and sodium levels, C. Intake, output, and daily weight, D. Measurements of abdominal girth and calf circumference. Answer: C. Intake, output, and daily weight. Rationale: urinary intake and output and daily weights are the best reflections of a patient's fluid volume status. When monitoring a patient who has diabetes and is receiving a carbonic anhydrase inhibitor for edema, the nurse will monitor for which possible adverse effect? A. Metabolic alkalosis, B. Elevated blood glucose, C. Hyperkalemia, D. Mental alertness. Answer: B. Elevated blood glucose. Rationale: an undesirable effect of carbonic anhydrase inhibitors is that they elevate the blood glucose level and cause glycosuria in diabetic patients. They induce metabolic acidosis, making their usefulness limited. In addition, hypokalemia and drowsiness may occur. When assessing a patient who is receiving a loop diuretic, the nurse looks for the manifestations of potassium deficiency. Which symptoms are indicative of potassium deficiency? Select all that apply. A. Dyspnea, B. Constipation, C. anorexia D, tinnitus E, muscle weakness F, palpitations G, mental confusion H, lethargy. Answer: C, anorexia E, muscle weakness G, mental confusion H, lethargy. Rationale: symptoms of hypokalemia include anorexia, nausea, lethargy, muscle weakness, mental confusion, and hypotension. A patient on diuretic therapy calls the clinic because he's had the flu, with terrible vomiting and diarrhea, and he has not kept anything down for 2 days. He feels weak and extremely tired. Which statement by the nurse is correct? A. It's important to try to stay on your prescribed medication. Try to take it with sips of water. B. Stop taking the diuretic for a few days, and then restart it when you feel better. C. You will need an increased dosage of the diuretic because of your illness. Let me speak to the physician. D. Please come into the clinic for an evaluation to make sure there are no complications. Answer: D. Please come into the clinic for an evaluation to make sure there are no complications. Rationale: vomiting and diarrhea cause fluid and electrolyte loss. The patient must not continue to take the diuretic until these problems have stopped. He needs to be checked for possible hypokalemia and dehydration. The other options are incorrect responses. The nurse will monitor a patient for signs and symptoms of hyperkalemia if the patient is taking which of these diuretics? A. Hydrochlorothiazide, hydrodiuryl, B. Furosemide, Lasix, C. Acetazolamide, Diamox, D. Spironolactone, aldactone. Answer: D. Spironolactone, aldactone. Rationale: spironolactone, aldactone, is a potassium-sparing diuretic, and patients taking this drug must be monitored for signs of hyperkalemia. The other drugs do not cause hyperkalemia but instead cause hypokalemia. When reviewing the mechanisms of action of diuretics, the nurse knows that which statement is true about loop diuretics. A. They are also called aldosterone-inhibiting diuretics. B. They are very potent, providing a diuretic effect that lasts at least 6 hours. C. Because their onset of action is rapid, they are particularly useful when rapid diuresis is desired. D. They have the disadvantage of ceasing to be effective when creatinine clearance decreases below 25 ml per minute. Answer: C. Because their onset of action is rapid, they are particularly useful when rapid diuresis is desired. Rationale: the loop diuretics have a rapid onset of action, therefore, they are useful when rapid onset is desired. Their effect lasts for about 2 hours. And a distinct advantage they have over thiazide diuretics is that their diuretic action continues even when creatinine clearance decreases below 25 milliliters per minute.